Yes.
Good morning, everyone. Very soon we are going to start the second day of this international conference. Mani sir, is it audible? Am I audible? Hello.
Vijay sir, yes, you're audible.
Okay, fine. Okay, thank you so much. Thank you. Afternoon, ma'am.
Bijoy sir, can you see my screen?
Just a minute. Yeah, yeah.
I
So,
can see.
okay. Okay, afternoon, ma'am. Please, you may proceed.
Okay, sir. Bijoy sir, just a second. We are facing a little technical issue with the voice. Just fixing that right now. Okay, just a second. So sorry for the technical issues that you're facing. Anyway, good morning, one and all present here. I Saida Afrin, Assistant Professor from Humanities and Social Sciences, Psychology Program, Assam Downtown University. Welcome you all to part 2 of this virtual international conference on strategic response towards promoting sustainable gender equality, experiences from the outbreak of COVID-19, organized by the Faculty of Humanities and Social Sciences, Assam Downtown University, in collaboration with Kalameda Research and Book Review Department of Rural Development and Agricultural Extension, College of Agriculture, Wolo University, Ethiopia. So before we begin, once again, I want to give a special mention to Dr. Bijoy Das, conference convener, Dr. Asha Sharma, Dr. M.K. Dev, the co-conveners. I would like to introduce today's chairperson, Professor Lanu Devi ma'am, Head of the Department Humanities of Social Sciences, Assam Downtown University. Dr. Devika Ayakpam, Assistant Professor, Sociology Program, Assam Downtown University. So today's program, it consists of the first, this is the part 3 of the program. It consists of plenary session 3, technical session 2. Let me introduce our first guest, Professor M. Tineshwari Devi, Assam University, Silchar, India. She's going to talk about gender and health disparities. Little bit about her work experience. She started her career as a researcher of European Commission project for the study of district health system of Thobel district, Manipur for a month, June to July 2003. She worked as a researcher for the project of Tata Institute of Social Sciences, Mumbai, on an all-India study of the implementation of the Central Social Welfare Board scheme of family counseling centers in 2003. She also worked as ad hoc lecturer at Delhi School of Social Work. And I think if we go on with her work experience, the list is endless and we can go on and on. So I would request Professor M. Tineshwari Devi to take over.
Thank you so much, Saida, for giving us such a nice introduction.
Yes, ma'am. You're audible and as well as you're visible.
Okay, thank you so much. A very good morning. A very good morning to all the faculty members of Assam Downtown University, Wolo University, Ethiopia, faculty, students, and ladies and gentlemen. First of all, I would like to thank the organizing committee of Assam Downtown University, Guwahati, and Wolo University for giving me this opportunity to reflect my perception on gender and health disparity. So I would like to share my PPT. Is it visible to all?
Yes, ma'am, it's visible.
I'll be speaking on gender and health disparities. COVID-19 pandemic is putting a very significant strain on the global economy and public health system. So COVID-19 is affecting women in many ways in terms of their health, safety, income insecurity, income security, and other exposure to domestic violence. So if you look at gender, gender is the most significant social phenomenon which shapes the multiple dimensions of women's social life. If you look at the study of Fikri and Pasa 2004, they argued that the status of women in Assam is much lower than that of men when compared to developed nations in the West. In fact, these rigid customary practices pertaining to families which keep them a woman inferior despite having various movements against such practices. And even the government has taken affirmative action, but nothing could solve it. If women want to achieve something, they face most of the time challenges from the cultural forms of gender norms. So if you look at the health aspect, we find that despite an increasing concern for the women's health in India, their exposure to illness continues to be very high. So according to NSSO 2014, this is mainly due to prevalence and operations of various social conditions in which gender is an extremely important factor, framing their ill health experience. Again, if you look at the gender gap index of 2019-2020 report from the slide, you can see that India dropped to 4 places. India was in 2018, it was 108 position, but in 2019, it is 112th rank out of 153 countries in the World Economic Forum. If we look at this gender gap index, there are main 4 indicators where they used to look into. That is gap in economic participation and opportunity, educational attainment, health and survival and political environment. And again, if you look at the ranking of different indicators, like India ranked 149th in economic participation or opportunity, and even rank 18 in political empowerment. But if you look at the health aspects, it's very, very unfortunate that India ranked 150th out of 153 countries in health and survival. That's why there's a significant gender and health disparity in India. So that's why in my presentation, I will be highlighting the multi-dimensional aspects that determine the concerns of women's health. You can see from this slide that there are different dimensions which are, fitting in or reflecting on the woman's health. There are a number of intricate and often interconnected factors that explain the prevailing gender gap in India. We often say that the root cause of gender inequality in Indian society is because of the patriarchal system. For example, if you look at the patriarchy in India, it includes prevailing customs in which inheritance passes from the father to son. Again, women moving in with the husband after the marriage. So this is kind of intergenerational contract which provide strong and social economic incentives for raising sons. But again, these incentives for raising daughters. That's why from this figure, you can make it out there is a lot more of gender discrimination in terms of sex ratio, in terms of child sex ratio. So there is, the preference of sons, which is very strong, and it is manifested in terms of limiting the birth and child survival, the girl's child survival. So as a result, from this figure, the sex ratio in India has become imbalanced. From this figure, again, you can see that in 1951, there were 983 girls for every 1,000 boys, but it went down to 945 in the year 1991. Again, in 2001, again, it reduced to 927. But in 2011, there is a slight increase with 940 girls for every 100 boys. But again, it's also said that this increase in the year 2011, or maybe in the last few decades, this is mainly because of the contribution by the number of senior or elderly single women. So again, according to the study of UNPF, if this widening gap in the child sex ratio continues, then definitely there will be a deficit of females around 23 million in the age group of 20 to 49 by 2040. So that is a very unfortunate picture. Again, if you look at Egypt, of course, lack of gender equality is very much seen. It's not only on the opportunities, access to resources and other opportunities, but it's a kind of improves the life prospects of the future generation. For example, if you look at the division of labor, you can see there's a sex roles. Like these sex roles usually limits women to domestic work, restricts their access to maternal and social resources, and participation in political, economic, and social decision making. For instance, like many adolescent female, due to the social structure we have in India, they usually have to help with the household work and take care of their siblings instead of going to school or even playing with their friends. So there is a gender-based inequality strongly seen it, that you can see it in this picture also, in this figure also, that female literacy rate is 65.4% if we compare with the male counterpart, 82.14%. There are again, because of this COVID-19, some recent data also shows that Adolescent girls spend significantly more hours on household chores compared to their male counterparts. But school closures because of the COVID-19 do not just mean that girls are taking on more of household chores at home. It could also lead to millions more girls dropping out of the school before they complete their education, especially for those girls living in poverty or disability. So the next factor, your dimension will be this poverty. Uh, a fundamental factor responsible for this gender inequality in India, one of the most powerful factors we all know, that's poverty. Poverty has various manifestations, including lack of income, hunger, malnutrition, and then limited or complete lack of access to basic services. So if you look at this data, out of the total 30% of poor people, 70% are female. This factor is closely associated with gender disparities in employment opportunities as well. According to World Bank data in 2020, women account for only 19.9% of the total labor force in India. As estimated by the World Bank, 90% of the Indian working women are employed in the informal sector. When they say informal sector, it includes, the tasks involving heavy physical work of different types and working for long hours with limited payment, and there is a lack of guarantee of minimum wages, and there is no job security, even the lack of minimum facilities at the workplace. So that's why the disparity, even in employment opportunities and the nature of work done in which they are engaged, that lead to women's, contributing in economy is disempowerment. Okay, this is the slides of this female and male labor participation rates of till 2018. So because of this pandemic, it hits those women who are the most vulnerable, like domestic workers, health workers, daily workers, and many more other women. Women are at the front line as health workers. They work for long hours and exposing themselves to risk while caring for patients. Yet their jobs are often undervalued and underpaid. If you look at globally, women make up around 70% of health workforce. They are the frontline workers, health workers, especially nurses, midwives, and community health workers. That's why this COVID pandemic definitely gave a kind of limitations or in terms of job. So there's a job stagnation and keeping women out of the labor force. Coming to the next dimension that is concerning on women's health, that is malnutrition. Nandi Foundation 2011 on hunger and malnutrition, they also call it Hangama, found that in India, as many as 42% of under fives are severely or moderately underweight, and that of 59% of them suffer from moderate to severe stunting, meaning their height is much lower than the median height. Further, the report also found that the awareness of nutrition among the mothers is also very low. So 92% of mothers had never heard of the word malnutrition. So that means you can say that without education, women lack confidence or knowledge to make their own choices. That's why we can see that women are being often encouraged or forced to marry at the early age. You cannot see my slides?
Yes, ma'am, we can see.
Okay. So I was saying that because of the lack of education, women lack confidence or knowledge to make their own choice. and that's why they are being forced to marry early. So India actually holds a miserable record of having highest absolute number of child brides, so about 24 million. So this represents 40% of the world's 60 million child marriages. You can see the consequences of child marriages. So because of the child marriages, women from the girls, they become to adulthood and frequently become motherhood. Because of that, it leads to more of health complications. So that's why a study done by NFI says in the year 2016, India's anemia burden among women is widespread. So with around 53.1% of non-pregnant women were anemic and 50.3% of pregnant women were anemic. So despite of having numerous various programs and policies to uplift the conditions of malnutrition in Indian context, but nothing is solving it. Again, another report that is Beijing Declaration and Platform for Action 2014 also stated that lack of power of women in most cultural settings impacts the nutritional intake and health status of women and girls. So that's how if a woman gives birth to the female child, then the child will again become malnourished. That's how the child's survival and nutritional issues increase, especially in Indian context. Coming to the next dimension, that is mortality and morbidity. Globally, about 800 women die every day of preventable causes related to pregnancy and childbirth. And 20% of these women are from India. 7 of the 10 causes of death in women in India are non-communicable diseases, such as heart attack, stroke, anemia, respiratory disease, etc. And again, if you look at the MMR, that there's maternal mortality rate in India, it has declined to 113 in 2016. 18 from 130 in 2014 and 16, according to sample registration system. However, though there is a slight decline, as it's been reflected as 122, this progress has not been very homogeneous, indicating the inequities with rural, urban, SC/ST women. In fact, SC/ST women face triple discriminations due to their caste, socioeconomic, and gender. Coming to the reproductive rights, reproductive rights are the least discussed aspect of women's health. Providing easy access to safe abortion services is still a big challenge in Indian context as well as globally. That's why 14% accounts of maternal deaths. This is because of the unsafe abortion. The health of a woman is not taken a priority in our country, where 75% of India's healthcare infrastructure is based in rural areas, and only 1.3% of GDP is focused for healthcare, which is significantly lower than that of the global average of 6%. But recently, because of the COVID pandemic, it has been little increase. If you look at the HIV/AIDS again, NACO estimates females living with HIV/AIDS, it's 2.02% is lower than that of males with 3.23%. But according to Sarkar 2011, it says that a high percentage of married women who are monogamous contract the disease from their husband who have multiple sexual partners. Again, very unfortunate that women has to face those social and cultural stigma, and they have been often blamed of contracting this HIV and AIDS. Actually, it is the men who are responsible for transmitting the virus to the woman. And then coming to the looking at the accessibility to healthcare system. Women seeking health system in remote areas often stumble upon the poor quality of services being provided, where they face a lot of mistreatment and abuse, even during the pregnancy and childbirth, which is giving a big trouble to them. Okay, then a recent study of outpatient cares in AIMS, Delhi, had revealed that the same problem in gender equality is happening. So of the over 23 lakh patients who enroll OPD patients in a year, the study said that male outpatients visited 1.69 times more than the female outpatients. And there were data of the National Health Profile 2019 also reflected that the annual account of demographics, the health schedules, health finance. If you look at the average cost of hospitalization for male patients in urban areas is rupees 30,450, and it is over 25% lesser for the women. Similarly, while the average cost of hospitalization for male patients in rural areas is rupees 19,727, and it is again nearly 28% lesser for female patients. So these figures are kind of reflecting of the health-seeking behavior differences between the males and females. Another very important dimension yesterday also many presenters have already said about the domestic violence and all. So crime against women. According to 2019 report, Crime Against Women by National Crime Records Bureau, a crime against women showed an increase of 7.3% in 2019. That is around 4.05 lakh cases from 2018. That was 3.78 lakh cases. So 88 cases of crimes against women were recorded per day. So that is a very, very difficult situation in Indian context. Majority of these cases were of domestic violence, which were being registered under the IPC, and they was registered under cruelty by husband or his relatives with 30.9%, followed by assault on women with intent to outrage her modesty, kidnapping, and abduction of women and rape with 8%. Even the cybercrimes has increased by 63.5 in 2019. If you look at again the pandemic situations of domestic violence, a study done through phone service in Delhi revealed that during the first 4 hours of COVID-19 related lockdown from March 2020 to May 2020, Indian women filed more domestic violence complaints than recorded in the similar period in the last 10 years. However, whatever the information we are getting it through phone, might be just the tip of iceberg, because there are many women who wants to keep silent even if they face many domestic violence and other violence. So across every domain, from health and well-being to economic growth, from protection and survival to social safeguards, the global pandemic COVID-19 is further deep-rooting the already prevalent gender inequalities. So its impacts are far more amplified and intensified for women just because of the gender. So I'll come to the conclusion. So from my presentation, I would rather put it like this. India has a long way to go before it can call itself a gender neutral country. So some of the suggestions I would like to highlight that to improve women's health, it must take full account of the underlying determinants, that is your, whatever I have said, the multi-dimensions. We have to take account of it. We have to be so specific of the socioeconomic and cultural barriers that hamper women in protecting and improving their health. We should address through providing awareness. When I say awareness, it can be within the family, starting from parents towards children. Then we can go to next neighborhood and schools, and then the community in the larger perspective. So that's how this cultural fundamental restructuring can be happen. And then you should also have this mindset shifting. We have so much of rigidity with this patriarchal concept. So there is a high time to have this mindset shifting. And also through widening access to public service delivery without discrimination on gender basis. And there is a need for advocating for and promoting equal value of girls, providing girls with the services and safety, education, and skills so that in whatever they need in daily life can be reduced the risks they face and enable them to fully develop and contribute to the India's growth. And then changing the value of girls has to include men, women, boys. And then it has to mobilize many sectors in our society. So only when the society's perception changes, when the rights of all the girls and all the boys in India may be fulfilled. So there's a very important, that is mainstreaming a gender perspective in assessing the implications for women and men, including legislation, policies, or programs in all areas and at all levels. Thank you.
Thank you, ma'am. Your presentation was very engaging today, and I think we have learned a lot. We have learned about the disparity in sex ratio, sex role, gender-based inequality, as girls are expected to, take care of the domestic work, then impact of pandemic on women, malnutrition, crime against women. So we'll be taking questions now. So the first question, I think there's one question in the chat box by Abdul Karim Muhammad. He has asked, what has been done so far to bring Indian women to the desired level of empowerment?
Okay, thank you, Abdul Karim. In fact, as I have said, if you look at the different aspects of health, there are different programs has been done. It like if you look at the maternal health, we have a mother and child health program which was introduced in the first 5-year plan. Again, likewise in 1997 also we have a reproductive and child health program being introduced. So like that, we have different programs being introduced time to time, but unfortunately whatever we have expected could not achieve. Otherwise, there are many programs being organized by the government. I could see questions in the chat box. Someone has asked me, is this review or original research? Actually, this is a review because I could not get much time. I'm sorry, I didn't say it in the beginning. It's just a review. Many from the secondary sources.
Thank you, ma'am, for your answers. Any more questions?
Okay. Hello.
Yes, sir. We can hear you.
Okay. Ma'am, thank you so much that you have highlighted so very important aspects of health and health issues of women that from the experience of the COVID-19 too. So, ma'am, just a small query from our side, like we have highlighted many of the differences, like among the male and men and women regarding the health and all. So, what measures that we can take that sometimes we know that culture is also a barrier sometimes regarding the digging health disparities of health among the men and women. So how what steps that we can take as an individual or from the perspective from the civil societies or the NGOs to reduce such health disparities from the cultural perspective, and how culture is affecting that such.
Thank you, Mr. That is very relevant question. In fact, if you look at this bringing a gender neutral country, when I concluded, I said that it's a long way to go for it, because whatever the findings I have seen, it is mainly related with the social cultural aspects. Until and unless we change such cultural barriers, in terms of the patriarchal concept we have in our society, it will be very difficult to bring us economic empowerment. Okay, because why I'm saying economic empowerment, because once a woman started taking up this, economic empowerment by themselves, they will have their own voices. They will be a part in the decision making. So if you look at the level force participation among the male and female participation is hardly 19.8% in compared to male. So there's a long way to go because of so much of rigidity towards women because of this cultural setup. So that's why I said in my conclusion that a wedding is one of the very important thing. We have to start from the families. See, there are a lot more of preferences of sons, and when we talk about this, childbirth. So that thing we have to change it. We have to shift our mindset by awaiting the people from the individual level within the family itself. Okay, even from the parents also, the way we always say that the household chores, "Ye ladki ka kaam hai, tumko nahi karna hai." So this kind of mindset we should start awaiting within the family itself. Once we start doing it, then definitely in the school level, even in the university colleges, we can do it. So from all these pictures, we can somehow bring a kind of a mindset shifting. This is one. Another thing, as we have said, the government and the civil society and the NGOs, they have to play a very, very important role, and they are been doing it to succeed some of these, issues. They are been doing it, but if we collaborate it more, not only in the upper level, it's coming down to the bottom approach. These all are quite important issues where everyone is working together. I think I have answered your question.
Yeah.
Thank you, ma'am. Thank you, ma'am. That was very insightful. I think it's really, in the situation like pandemic, we are making this virtual international conference happen like this. It's itself is an example of how we all are coming together, and we are actually making it work. So I think thank you so much, ma'am, for joining us today. And yes, sir.
Okay. If ma'am has time, so with the permission of ma'am, so can you put one question forward, because Birhanu Tadese from Ethiopia, he has asked,
yes, sir.
Yeah.
Yes, sir. One question we have received.
This is the last only we are taking. Yeah.
Yes, sir. Birhanu Tadese had asked how cultural structuring is important.
Okay. Your question is how cultural structuring is important. Yes. In Indian society, this social cultural structuring is very, very important in terms of, because if you look at from the individual perspective, if you see that when a child is given a birth, okay, so from there you can start, like if the child happens to be a girl, then again there are rituals which is being associated with the girl differently than the boys. And at the time of when the child is growing up, when it turns to adolescencehood, and if it is a girl, the kind of treatment is different, and the boys also, the kind of treatment is different. As I have given you example of household chores, there are so many concepts saying that boys have to do this way and the girls have to do this way. So likewise, this kind of little culturally, ritually, we are being imposing towards the mindset of the girls and boys. Definitely when they grow up, the concept of patriarchal mindset is becoming very, very strong. So that's why this cultural or structuring is very, very important, where it will, widen our mindset. That's why I said in the whole discussion that when I began my discussion, also these cultural aspects, to call the concept of the patriarchal society in Indian context, this is limiting the woman in assessing the opportunities in different aspects, and definitely is affecting the health as well. Yeah, thank you.
Thank you, ma'am. Is there any other questions?
Okay, Afrin ma'am.
Yes, sir.
Okay, so if no questions, so we can hand over the session to our chairperson, ma'am, Mr. Lanu Devi, ma'am.
Okay, sir. All right. Thank you so much, ma'am. Once again, I think it has been a very, very interactive session. And now, the technical session, I would like to hand it over to our chairperson, Professor Lanu Devi, ma'am, head of the Department Humanities and Social Sciences, Assam London University, and moderator, Dr. Devika Ekpam, assistant professor, sociology program.
Thank you, Afrin. Thank you, Afrin.
Yeah, ma'am.
Now we are starting the technical session, and Devika will read out the rules and time limit regarding the presentation of papers.
Thank you, ma'am. Warm welcome to you all present here once again. Now we are going to start the technical session 2, and I request all the presenters to get ready with their presentations. And we will be going according to the list that is given there. So I request the first presenter of today's technical session 1, Ivan Sara and Pardorkar Kharkokar, to get ready with their presentation. And the name of the paper, the title of the paper is A Preliminary Study on Effects of COVID-19 Pandemic on Mental Health of Women in the City of Shillong, Meghalaya.
And regarding the time limit, I want to say that each presenter will get 10 minutes to present, and all the presenters will present the papers. And at the end of the presentation of all the papers, there will be a question and answer session. But I strictly request the research presenters to keep the time limit so that we can finish in due time and a session for questions and answers can be kept. Thank you so much. So I request the first presenter to present the paper. Is our presenter there or not?
Once again, can we just announce the name once again?
What's the name, Deepika?
Okay, then the first presenter is Yuansara M. and Pardorkar Khankogor. Yuansara, are you present?
Ma'am, there might be technical issue. So we can move ahead with the next one, Remika Jones, the Kharlukhi and Iwani Jones.
Yes, we can do
Yes,
that.
ma'am, you can introduce them.
Okay, next presenter is Remika Jones and John C. Kharlukhi. The title of the paper is Village Council, Durbar's known as a frontline workers in combating COVID-19 pandemic with special reference to Meghalaya. Remika Jones and her partner, are you present?
Yes, ma'am, we are present. So,
Okay,
we'll
can you start the presentation?
Okay, thank you.
Okay, please keep that one, requesting you to keep the time limit, that is 10 minutes to complete it within that time limit.
And I request
sure.
moderator to keep the time limit.
Okay, ma'am. A very good morning to everyone present. My name is Rumika Jones D. Kharlukhi, Assistant Professor, Sociology Department, KL Bajoria College, Shillong. And my co-author is my very own sister, Iwi1 Ini Jones D. Kharlukhi, Research Scholar, Department of Adult and Continuing Education, Northeastern Hale University, Shillong. So the paper that we're going to present now, actually we're going to present the paper together, both of us. So I'll be starting. Now the paper that we are going to present, it is on Village Council, Darbar Shillong as frontline workers in combating COVID-19 pandemic with special reference to Meghalaya. Now, the COVID-19 pandemic, it is exacting a huge toll on individuals, families, communities, and societies across the world, our country, India, and in particular, the state of Meghalaya. Now, daily lives have been profoundly changed, economies have fallen into recession, and many of the traditional social, economic, and public health safety nets that many people rely on in times of hardship have been put under unprecedented strain. Now, to tackle the problems arising as a result of the COVID-19 pandemic, Meghalaya's strong pandemic response over the past few months makes a convincing case by empowering the local institutions or the village councils. Now, in combating COVID-19 pandemic, the government, it cannot just rely on the police or either the government administrators or health workers like the medical and paramedical staffs, the auxiliary nursing midwifery or ANM, the Anganwadi workers, AWW, and the accredited social health activist, ASHA. So therefore, the government, they involved the village councils as frontliners by setting up the community COVID management committees or team to provide sensitive support to their own members and assist the government in its fight against COVID-19 pandemic. Now, the village councils or the Dorbar Shnong. Now, the village councils in Khasi Hills revolve around the institutions of Dorbar, which is actually a three-level arrangement of governance. Now, a typical traditional institution in the Khasi community constitutes larger territory based, or the Hima, which is actually controlled by the scheme. Now, at the lowest level of governance is the state of Meghalaya. There exists the traditional Dorbar Shnong or the village councils. Now, the head of the village councils is known as the Rangba Shnong or the Sardar or Mintri Shnong. Now, he's the one who is responsible for governance of forests and other community, the common property resources of the village. Now, Rangba Shnong is the head of the village. Now, he is also the caretaker of the people and resources of the village. He presides over the meetings of Dorbar and also the executive committee. Rangba Shnongs, they have a secretary who is a custodian of all the records and the office of the Rangba Shnong. Now, besides looking after the welfare of the villagers, the Dorbar Shnong or the village councils, they supervises customary practices and enforces discipline among its members. Now, nowadays, the responsibilities of the Rangba Shnong has increased manifold as most government schemes implemented are done through him and members of the executive committee of the village. They actually play a vital role or a major role in implementation of the community development as well as infrastructural development schemes. Now, the decision with respect to policies and with regards to sharing of benefits and implementation of government schemes and programs are taken in the respective Dorbars. Now, the Dorbar has also the power including promulgating new regulations and review and revision of existing rules. Now, the executive committee can take day-to-day decisions, particularly related to implementation of the decisions of the Dorbar. Now, all decisions are taken through consensus, and voting, it is actually avoided in meetings. Now, any decision taken is binding on all people living in the jurisdiction of the village or the Raj or the Hima. So there is no scope of appeal or prayer for preview except in matters related to justice, related to criminal or either civil matters. Now, traditional grassroots institutions or these Dorbars are strong authorities in the region, having governed tribal communities and their lands since ages. Now, traditional bodies have always been community-driven institutions, and they now act as a bridge between the modern states and the tribal communities. Traditional institutions, they appeared here as participants who can play a vital role. Now, people, they defer to them and the decisions they make, and they can connect directly to the people. Practically, nothing moves in the village without the consent or approvals of the Rangbashnong and his secretaries. Now, I'll hand over to my sister. In view of the many roles that is being played by the village councils or the Darbarshnong in East Khasi Hills district of Meghalaya, the government of Meghalaya, in its effort to fight COVID-19, have included early preparedness efforts, provision of proper quarantine centers for returnees from other states, logistical support to those who are home quarantined, as well as assistance to those who remain outside the state. The government has also been actively collaborating with the traditional institutions for more effective administration and supervision, and come up organically with the community COVID management committees or team to help the state agencies track the situation and strictly enforce COVID-19 protocols. In view of this community COVID management committee or team, we have actually conducted a focus group discussion with one of the Darbarshnong, who is running one of the most successful, I can say, community COVID management team of Maula Yoringha, which falls under East Khasi Hills district, in order to gain an in-depth information on the members which is involved in the community COVID management team, then the role and functions of the community COVID-19 management team, then other supportive functions played by them and the challenges that they face in its efforts to provide sensitive support to their own members and assist the government in its fight against COVID-19. So, in accordance with the government of Meghalaya, the protocol that they have given to these local Darbars or the village councils, the following are the results of the focus group discussion conducted. The members involved in the community the members involved in the community COVID-19 management team are the headman, the secretary and other executive members, the block development officer, sector officer as an advisor, the ASHA, the Anganwadi worker and other health workers, namely doctors and teachers representative, are all members which are included in this community COVID management committee. And also you will see that these community COVID management committees, they play a very important role. They have a lot of roles and functions that they play in order to combat the spread of COVID-19 in these areas. There are some functions that they have played. The first one is that although there are several state government-run quarantine centers for returnees, the committee, along with the help of local volunteers, are running community-driven quarantine centers to ensure safe and comfortable stay for returnees from other states. The quarantine centers are provided with proper bedrooms, bathrooms, and Wi-Fi connectivity for the returnees arriving from outside of the state of Meghalaya, with voluntary supervision and of the concern. The second one is that they ensure compliance with SOPs for all residents, like wearing a face mask, voluntary maintaining social or physical distancing, frequent hand sanitization, and following respiratory etiquettes. Also, strict regulatory measures are being on social gathering, events, and inter-house visits were taken. Also, restriction of movement of high-risk contacts, monitoring for home isolation, and necessary sanitization of the household. Also, they encourage these community COVID management team. What they do is that they encourage persons to come in contact with positive tested COVID-19 to inform local authorities. Another important role that they play is that in order to create awareness to the community people in that particular area, what they do is that every morning a public announcement is made by means of a public address system regarding the COVID-19 outbreak. And also they ensure that in the community that there is zero tolerance to stigmatization of COVID-19 patients and those under quarantine. And strict instructions are also being issued to the local people to stay indoors and leave their houses only if it is necessary for them to do so. Besides the above mentioned functions and roles, those are the roles and functions that has been, envisaged in the protocols that is given to these community COVID-19 management team. But also, there are also other supportive roles that these community COVID management teams play in order to combat the spread of COVID-19. The COVID-19 pandemic has led to dramatic loss of human life and present and unprecedented challenge to public health, food system, and the world of work. The economy and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people may increase. Workforce is at risk of losing their livelihoods. Informal economy workers are particularly vulnerable because the majority lack social protection and access to quality healthcare and have lost access to productive assets. Without the means to earn an income during lockdowns, many are unable to feed themselves and their families. For most, no income means no food, or at best, less food and less nutritious food. The pandemic has disseminated jobs and placed millions of livelihoods at risk. As breadwinners lose jobs, fall ill, and die, the food security and nutrition of millions of women and men are under threat, particularly the most marginalized population. For these many reasons, in order to provide solidarity and support, especially to the most vulnerable sections in the community,
your 2 minutes are over. You have taken more than 10 minutes.
Okay, I will just wind up. Okay, so they also have extended support in the following areas, that is permitting street vendors in view of the closing down of marketplaces for selling of essential commodities. They also observe morning prayers and meditation without affecting the religious sentiments of the people. And also they supply food and other essential commodities for those under home quarantine. And they also identify the most marginalized sections in the community who have been deeply affected by the pandemic by providing them with food and other essential commodities. And all these things, all these activities that has been carried out, I can conclude that all these the traditional institutions or the village council, they play a very important role during this COVID-19 pandemic, because you will see that all these functions and roles that they play is all on a voluntary basis, and all the expenses is mostly bared by the community people itself and not by the government or anyone else. Okay, thank you.
Thank you, Rimika and Ibiwa Nini, for your nice presentation, enlightening us about the village council as the frontline workers in this pandemic situation. And we will be taking all the questions in the end of the presentation after finishing all the presentation. So please stay with us till the end of the presentation. And I'm requesting everyone to put their questions in the chat box, mentioning the name of the presenter, so that we can tackle the question in the end of the discussion. Next, I would like to request Dr. Asha Sharma and Dr. Vijay Das to present their paper entitled The Gender Impact of COVID-19 on Mental Health. Asha ma'am, are you there?
Yeah, am I audible? Am I audible
Yes,
now?
yes ma'am, you're audible.
Okay. Extremely sorry. Actually, I was unmuted. So
It's okay,
the
ma'am.
title, yeah, a very good morning to one and all. The topic of our presentation is the gender impact of COVID-19 on mental health. So, as we all know that COVID-19 has taken a toll over our mental health. Most commonly, psychological problems are anxiety and depression. And women being the
Hello.
most vulnerable. Yes, I can hear some background noises. Yeah,
Please.
I would request my co-presenters to kindly unmute. Yeah, so the common problems are sexual and physical abuse, and women being the most vulnerable section. With lockdown and the protocols
Asha
of
ma'am.
yes, Vijay sir.
You stop presenting now. Again you restart because some echo is there.
Okay, okay. What should I do now? Time minute घुसे जाओ. Yes, yes. No, no, I don't want the video. I want to see the screen. That's it. Okay. Am I audible now?
Yes, ma'am, you're audible.
Yes, thank you. Sorry for the interruption. So, while we were talking about the impact, so lockdown has a significant impact on the mental health of women, physical distancing, then taking care of the elderly. As we all know from the statistics also, it is revealed that 70% of the women hold a less secure jobs with an exponential increase in pay cut and job security due to the shadow pandemic. Most of them are falling prey to poverty, and especially for the single parent or the female headed households, they are facing significant difficulty in supporting or sustaining themselves and their families. So I'll just cut short a few slides. I'll try to sum up my paper on focusing on some significant aspects which I have tried to delineate. One is the lockdown impact on women. So here are a few features that I have tried to delineate. Confinement around the four walls of the residence, which is very, very emotionally taxing, especially for the working woman, because that leads to a very monotonous life. Taking break for work, although it is leisurely feeling at times, but during the pandemic, it has never been a very leisurely feeling, especially for the working woman. And taking care of the elderly and the sick ones could lead to additional distress, fear of losing, apprehension regarding the job security, pay cuts, and increased conflict among the family members, especially between the spouses on certain family related issues. And in poor families, the most worstly hit are the women who are subjected to gender based violence. Now, coming to the other aspect, that is relating to the pregnant woman and the woman who has just given birth to. So, pregnancy, as we know, it is a very, very significant and most wonderful phase of a woman's life. But during the COVID-19 pandemic, it is accompanied with a lot of mental and physical problems. Pregnant women who are exposed to the virus, and they always have this fear that this virus could have a teratogenic effect on their uh, baby. So, however, in spite, this is a myth, however, because anecdotal report of placenta transmission in the second trimester is also available, and they say that there is no such, transmission from the mother to the womb. But still, there is certain myths that most women live with, and that could be one source of anxiety for the pregnant ladies. And if we see the reports from WHO, who suggest that pregnant women who are older, overweight, and have pre-existing comorbidities like hypertension and diabetes are more vulnerable to COVID-19. Further, during pregnancy, as we all know, there are certain hormonal changes and changes in the immune system, which also increases their susceptibility to get affected by the virus. Now, talking about the breastfeeding mother, as we all know, there is a term called postpartum depression. It has been reported a surge during COVID-19, and the reasons could be the negative environment which is prevailing around due to the COVID-19, the aggravated emotions of the breastfeeding mothers due to the social media. They are bombarding with new cases every day. The family structure, especially nuclear families where the mother has to bear the burden, and there is a lack of visits due to the fear of getting infected. Social isolation, distancing from the family members could exacerbate the psychological could exacerbate the already existing anxiety, and could take the form of disorder later. Then comes mental fatigue arising out of the multiple roles where the new mother has to perform all the household chores. Apart from that, they are also engaging in professional work and taking care of the baby. A lack of adequate sleep, fear of losing job, fear of difficulty in accessing emergency medical services. Finally, then we have the women who are working from home. So working from home has been misinterpreted as enjoying the luxury in case of women. However, a new study carried out in the year 2020 entitled Women in the Workplace reported that mothers are 3 times more likely to be responsible than fathers for managing household chores and childcare. And the woman being in the forefront of the household activities has been seen to be performing a wide variety of activities like managing household chores, taking care of the elderly, childbearing, which has resulted in physical and mental exhaustion, especially among the working mothers. And as a result, they are undergoing chronic stress, exhaustion, and burnout. So there are other studies also. Again, talking about the teacher fraternity, they are also, undergoing a revolutionary change in the way they take classes. The teachers, they have to, overnight, there is a transformation to online platform. They had to adapt themselves to the techno-based, the virtual environment. Okay, they had to learn using various technology, which is in itself is very, very stress-inducing. Then coming to the female frontline workers during COVID-19. So the frontline health workers are also at a heightened risk of getting adversely affected. There is always the fear of getting, getting affected by the virus. Apart from that, they also had to go through a lot of social stigmatization. People are distancing, their own family members are distancing from them because of the fear of getting infected. And especially for the mothers, staying away from their own children could be a very, very, emotionally turmoil stage. So I would just like to come down to the conclusion that from the above discussion, it is imperative that women are really the most worstly hit section, and they are more vulnerable to the COVID-19 pandemic. So with an increase in the incidences of gender-based violence during the pandemic, women are repeatedly facing issues of psychological distress, which is causing them to develop problems like anxiety and depression. In addition, job loss in case of working women, taking up dual responsibilities, acting as a caretaker for the children and elderly who are afflicted with illness, apprehensions of a pregnant lady about childbirth could exacerbate their fear and worries. So there is a need to provide proper mental health services to the women population. So to name a few would be free consultation with a psychiatrist, then availing counseling services. Nowadays, telecounseling is very much popular. And apart from that, there has to be certain, policy making decisions on part of the government to work towards the empowerment of women in respect to mental health as well as their physical health. So that's all about my presentation. Thank you.
Thank you, Asa ma'am, for enlightening us about the affected women in this COVID-19 situation, how women are affected during this pandemic and how they are facing the challenges. Thank you so much. And we will be taking all the questions after the presentations. So please stay with us.
Okay, ma'am. Thank you.
And I'm requesting everyone to put their questions in the chat box, mentioning the name of the presenter to whom the question has been referred. And we can start going forward with the next presentation that is going to be given by Ms. Silvi Sika Das. And the title of the paper is The Status of Maternal Health During COVID-19. So Ms. Silvi Sika Das, are you present?
Yes, ma'am, I'm present.
Okay, please start the presentation.
Okay. Good morning, everyone. I'm Shilpi Shikha Das. I'm a resource scholar from the Center of Social Medicine and Community Health, JNU. The title of my presentation is Maternal Health Status During COVID-19. The videos, pictures, news headlines related to pregnant migrant women walking miles to reach home, reports of childbirth on the roadside with no or minimum assistance, women in labor being taken from one hospital to another, stillbirth, women giving birth in the ambulance, auto rickshaws, and even hospital barandas are some of the instances that occupied our everyday life in discussions and debates during the lockdown. The paper will discuss the broader concept of the challenges faced by women during the lockdown, but it would also focus on pregnancy and childbirth. So, as the previous president set the dice very well by giving all the statistics, I really thank them. But I would like to focus on three main indicators. That is MMR. According to the maternal mortality in India, according to the data published by Registrar General Sample Registration, the MMR of India during the period of 2016 to 2018 was 113, and Assam recorded the highest with 237 MMR. So we can understand the state of the existing conditions of maternal status even prior to the pandemic. Anemia cases were very high. In Assam, it recorded 64.1 of the age group 15 to 49 years. Also, the Global Hunger Index categorizes India as serious. According to UNICEF, maternal mortality is a key indicator, and the direct causes of maternal deaths are well known and are largely preventable. So the paper would discuss based on the two models of healthcare service delivery and its impact on maternal health status. The two models are the 4As and the delay model. So the 4As refers to availability, accessibility, affordability, and acceptability of the healthcare services. And the delay model, it refers to delay in decision making, delay in availing or reaching healthcare facility, and delay in receiving care. So based on these two models, there are following observations which I have which I would like to point out, and it would help us in understanding the maternal healthcare services that are in the policies, but which all the barriers that was faced by women in achieving them. So the first is delay in care and treatment. There are various factors that have caused barriers in receiving healthcare facilities in the needed time. So the second is refusal or denial of care, as most of the private hospitals have stopped the emergency care because of the unavailability of PPE kits. There were also many cases that were highlighted during the lockdown where women were denied or even the services were delayed because of the COVID test results. The third point is increased cost of healthcare services. Due to more demand and less supply, the cost of healthcare services increased during the lockdown. We also have to keep in mind that the out-of-pocket expenditure of India is very high. That is, in the year 2013 to 2014, it recorded 64%, which is very high. Lack of nutritious food and supplements was one problem that was faced by women, as the networks and the supply chain was completely cut off. Therefore, the supply of nutritious food and also the supplement that is received by pregnant women was a bigger challenge. Unemployment was another problem which affect the affordability of nutritious food and supplements. Dependency and workload. The workload during the pandemic was quite high for both pregnant and non-pregnant women. Also, the dependency. The employment rate was very high. A study conducted in 20 states of India found that 76% of women in the informal sector have lost their jobs compared to men. The sixth point is misinformation, lack of awareness, myths, and stigma. Due to overcrowding of information in social media or any other channel of communication, misinformation was very high, which added to the burden of anxiety and stress in pregnant women. Lack of social support and also support for that matter was another barrier that was faced by women, which affected the mental health of the pregnant women. Anxiety in accessing healthcare facilities have doubled the burden. Also, in our society, where cultural and traditional norms related to pregnancy and childbirth holds a very important place, which also adds as a social support for the pregnant women, as there is because of the lockdown, due to the restriction of movement and social distancing norm, many such rituals could not be celebrated or followed, and thus that social support was not received by the pregnant women. Another important barrier and challenge was the annual floods of Assam. Assam, though annual flood is very common in Assam, but this year the intensity of the flood was so high, which affected the network basics of basic needs of food and um, relaxation for the woman was a challenge, because a small area was overcrowded by too many people. Another interesting point is telemedicine. Telemedicine has been seen as a blessing during this time of lockdown, because the communication became much easier where services could be availed. But many pockets of India where internet or electricity, use of phone is a far away dream. So telecommunication is not possible and feasible for many pregnant women to avail services. Maternity leave and COVID-19. Work from home, when it becomes very normalcy for many of us, it is also a challenge, because work from home became much easier and maternity leave became another challenge for women in the formal sector. So caste, along with other social determinants, became a very important barrier in access to health. There are some attempts made by various organizations, individuals, and concerned citizens in highlighting these issues of maternal health status in the country during the lockdown. I would like to cite two examples. A campaign was started by a group of concerned citizens to publish data on maternal death in the country due to the lack of access to healthcare delivery. But unfortunately, the data is still not made public. Sama, a Delhi-based resource group for women and health, filed a PIL in the Delhi High Court, seeking directions to the government to pass appropriate orders to ensure that no pregnant woman is denied or discriminated in accessing healthcare services, or to take actions against hospitals that refuses access and or admission to pregnant women. So, in conclusion, I would like to put this following points. Institutional and medicalized maternal healthcare services are not enough to address direct and indirect maternal health needs. Pluralism of medicine is important, along with making space for knowledge sharing and knowledge generation. Collaborative, integrative, intersectional initiatives are important to make inclusive and more reachable healthcare policies. The need of the hour is to create long-term and short-term goals to take social determinants and the intensity of the pandemic into consideration. I would like to continue by saying that let the testimonies, narratives, and the lived experiences of the individuals
guide us in making universal healthcare reach one and all. Thank you.
Thank you, Ms. Sika Das, for your presentation by focusing on the mental health during the COVID-19 situation. Next, we have Vada Sukli Karsangi on his topic, Strategic Response by Women Street Vendors in Meghalaya to Economic Crisis during COVID-19.
Hello. Good morning, everyone. I would like to share my presentation, my PowerPoint presentation I prepared.
Yeah, please go ahead.
Yes, ma'am. Actually, can you please guide me how to share my PowerPoint presentation? I don't know exactly on this. I cannot hear you. Yes, I click on the present now. Sorry, I cannot hear you properly. Okay, share the screen share. Okay, I click on this share. Share this presentation. Is my PowerPoint visible to you all?
No, it's not yet visible.
Hello?
Yeah, it's coming now.
Okay. I'll start presenting now. Okay, my name is Karshandi. I'm a research scholar in Department of Health and Consumer Education, Eastern University, Shillong. Okay. Okay, good introduction. Here we can see that the title of my research paper is Strategic Response by Women Street Vendors in Meghalaya, the Economic Crisis during COVID-19. So we are all aware about this COVID-19, the coronavirus disease, or also known as severe acute respiratory syndrome coronavirus, which emerged by the end of 2019 from the Wuhan city of China. This pandemic has been declared by the International Labour Organization not only as a health crisis, but also as well as an economic and labor crisis. The WHO declared this public health emergency of international concern and called it as a global pandemic. So, since at present there's no vaccine that has been invented to provide protection against this virus, so the main effective tool that most of the countries are exercising is this lockdown in order to weaken the virus spread. So because of this lockdown, even in India also, we find that India has exercised its complete lockdown since March 24, and the lockdown was extended for 6 weeks. As we know that the economic condition of India is already worse, not because of this coronavirus pandemic, but because the economy of the country is already in a bad situation. And the incident of this pandemic has further worsened, has further aggravated the final
Yes. Iba, we cannot hear you. Iba Sukling, we cannot hear you.
Karsani, are you there? I think she is facing some technical issue, so everyone please stay with us.
Mine is working, but she is not there. Mine is not muted, but you have not heard.
Karsani, are you there?
Sorry for the inconvenience. I think sorry for the technical difficulties. So I think we have lost the connection with Ibasukle. But we can move ahead with the next presenter. Once again, I will be announcing the name one last time. Ibada Suklin, are you there? Please respond on the chat box if you can hear us. Okay, so Ibada Suklin was presenting in the topic of strategic response by women street vendors in Meghalaya to economic crisis during COVID-19. Since we are running short of time, we will be moving ahead to our next presenter. So Devika ma'am, you can announce the next presenter.
Okay, proceeding further, we will be continuing with the next presenter, that is Mr. Joel Islam and Dr. Aditi Nath. And the title of the paper is Youth Volunteers as Frontline Workers, Challenges Encountered During COVID-19 Pandemic. So Mr. Joel Islam and Dr. Aditi Nath, are you present?
Yes, ma'am.
Okay, please continue.
Hello, ma'am. Yeah.
You can carry on.
Hello, ma'am. Just can you see my PPT, ma'am?
Yes.
Hello.
Hello.
Okay. Can you see my presentation, ma'am?
Not yet. Can you please try again?
Yeah. Sharing the share my share. Hello, ma'am. My PPT is on the screen now.
Yes, we can see your
I have
presentation
shared.
on PPT. Please
Thank you,
proceed.
ma'am. Good afternoon, respected supervisors, respected present here in this Google Meet webinars. Today, I'm going to present a presentation on youth volunteer as a frontline worker, challenge encountered in the COVID-19 pandemic. Myself, Jaul Islam Choudhury, and Dr. Aditya, Assistant Professor, Department of Social Work, Assam University, Silchar. We togetherly working on this paper, and first of all, I would like to thank Dr. Bijoy for inviting me to present in this paper. Just without wasting my time, actually, we all know about the pandemic and the very hard experience, and especially the role of the youth, and what are the problems, what are the challenges they have faced during this COVID-19 pandemic. So I'm going to discuss on that, especially. First, I would like to discuss about the youths, then second point, youth volunteerism, then what are the youth profile in the district and as a whole as a district, what the youth profile in our district. My study area is in Tripura, Gomti district, where I have studied 50 years in Central. And I have considered the youth as 15 to 29 years of age, that is under National Youth Policy in 2014. And presently 28% of the total population belongs to youth, that is 15 to 29 years of age in my district. And since during this I have interaction, I have found various activities, programs, and the various challenges they face during this COVID-19. They are working as a youth volunteers in the various part of the district. And when I'm talking about the volunteering, because it is when we study the historical matter view, then our society, Indian society is always directly linked with the volunteerism, and youth has a certain role, very important key role in the promotion of volunteerism in any social crisis in our country. And when we look back to the history of Gomti district, and youths are very active and participate in any kind of disaster issues come up in the district, and youth have a very active role in all kind of disaster, any kind of emergency, and like response and rehabilitation, everything. Youth plays a very important role in the district. When we talk about the youth profile in the district, youths can be divided into student and the non-student youths. Those are student youths who are working, who are student, who are regular student in the school, colleges, and those youths who are not in the school and colleges. They are dropped from the institution, and they are working as voluntarily youth in the various activities in our society. And in the district, there are more than 198 youth clubs which are working, which are participating in various areas in the health area of the district, as well as all youth has a very important role in terms of any kind of social activities in the district. Gomti district is the new district in 2012. It was split Tripura 2011 up to as part 2011 census. South Tripura has been divided into the two districts. One is in the Gomti district and one is South Tripura. My study is based on the Gomti district and the role of youth volunteers, like frontline workers, problem and challenges faced by youths, especially frontline workers, in during the pandemic situation. Next, what are the main programs, their activities during this pandemic? How these youth frontline workers are initiating various kind of activities in the entire district. So first, I would like to express about the social awareness, because youth play a very important role in spreading the awareness on COVID-19 and how we can do safety. And they are having a small linkage with the youth volunteers in different areas. So linkage between the youth among the youth club members from the different villages, and creating a very sense of very important issues like the social awareness is a very important part in the COVID-19. Then second point, to maintain the social distancing, they are working in many ways like the motivation, counseling, and giving home visit, or especially motivating the youth to not go outside, during this pandemic, and what should be our role and how we will stay. So all sort of things, youth volunteers are playing a very important role in maintaining the social distancing. Then coordination with the line department, because youth cannot do anything, because youth are the most what to say. Youth cannot do anything without any line department, because you have to coordinate with the line department, various line departments, for example, health department, social welfare department, various other non-government organizations also come out, and they are very much coordinating with the various line department, and very much helpful one another, coordinating each other, and how to control this pandemic situation, especially in the COVID-19 in the villages. And really, it gives lots of impact, and the district administration has strongly supported, especially recognized about the youth contribution in the especially COVID-19 situation, COVID-19 pandemic. Third point, resource mobilization. Youths play a very important role in the resource mobilization in the village, outside the village, through a network. Youths are mobilizing the resources from the village elders, and they are distributing the materials. They are, to the below poverty line families who are daily wagers, and like beggars, like animals, feeding the animals also. So these are the various, program which has been initiated for the, villagers, for the, society, especially in the pandemic situation. Resource mobilization, when we talk about, is not only financial but also various other ways. Resource mobilization has been carried out by the youth frontline workers, especially human resource mobilization, because youths are very much, not aware about the uh, COVID-19. At the same time, there's always a challenge to participate in the such kind of coordination, such kind of awareness program, because of the risk factor. So human resource mobilization, youth mobilization is also one of the very important programs, activities of the youth frontline worker in the epidemic time. Then the transportation and resettlement. There are so many issues has been come up with the resettlement and the transportation during the COVID-19 due to the lockdown, 3 phases of lockdown. People are facing lots of huge challenges, especially in the pandemic. Youth frontline workers are coordinating with the various line department, transportation, police, and medical team, plus as well as the local stakeholders to transportation and resettlement of the people who are facing problem, especially during the COVID-19. Next point I would like to stress about the awareness and teaching on the hand washing, because generally people are not aware much about the hand washing. No, such kind of some kind of small training, like small group meeting, and awareness on how to hand wash and how to take care of ourselves, and including distancing, social distancing, and different materials. I see information, education, and communication material. With the help of them, like hand washing practice has been introduced to the mass people through the youth frontline workers. And home visit, village level home visit is to carry it out by maintaining the social distance and how to take care of the children and the senior citizens. So these are the very various activities, like hanging the banners about the awareness of COVID-19, then counseling with the infected and affected population, and this counseling also a very important play in motivating people in the mass society, especially in the COVID-19. Distribution of IC materials. Youth frontline workers are collecting various type of IC material from the government institutions, and voluntarily they also publish various information in local language to train and teach about the seriousness of the COVID-19, how to care of that, how to be free from that, and it really helped the public. And during my age of introduced to, I found that people are accepting so much, and this kind of practical help, creating such an environment to people cooperate and to shape the whole society. And livelihood, of course, so daily wages when people are not working for 2021 days in the first lockdown, the second lockdown, and third lockdown, really, chaos situation in the village. And these youth frontline workers are mobilizing financial support from the village elders who are service businessmen, service holders. They are contributing, money and helping the livelihood of those weaker section of people, especially daily wagers, widows, beggars, and animals, and the street also. So these things has been very active. I have just mentioned some of the activities which were carried out by the especially youth frontline workers during the pandemic in our district, Community District of Tripura. Now, I would like to discuss about the main challenges about the challenges of frontline workers during this pandemic area. First, I would like to talk about the lack of preparedness, because the youths of within 50 to 29 years of age, they have a less experience or kind of preparedness, lack of preparedness. Youth frontline workers are facing lots of challenges. It just a sudden happen without any plan, without any preparedness. So, voluntarily coming up, mobilization of the volunteer youths, and at the same time working in this time. So this lack of preparedness, youth volunteers and youth workers, front workers are facing.
Your time is what? Please sum up.
G. Lack of second point, I would like to mention about lack of experience in pandemic situation, because of such kind of, just I will sum up now. Uh, because of this experience, unexperience or lack of experience in pandemic situation, and then financial resource, and youth frontline workers or youth club that don't have such sufficient resources also, especially in financial, is a voluntary organization. Then third point, anxiety and fairness among the youths. And the youths are definitely these situations creating the mind of the youths about anxiety and fairness of going outside from home. Then fear and anxiety of the family decision to society. And next point, challenge in the maintaining social distancing and washing. So people are aware but not care about that. But it is also one of the big challenges to maintain the social distancing and washing, especially in the mass people, especially in the rural area, especially in the society also. Delay in testing, not interested for testing or running away from testing. This is also one of the big challenges. And the youth online workers are mainly stressed on this to know about the status or testing is a very important part to understand or to know about the COVID situation or COVID condition in our body. Third point is stigma, and you're unaware of the situation. There are so many stigmas, like trying to avoid running away from the divisional ground, and they are always fair about the testing, whether if I may be positive or not in this sort of situation. Then coordination and communication. Yeah, of course, there are various kinds of departments, though all departments have become very challenges, and then how to control and how to manage the situation. So youth frontline workers are also some kind of coordinations are getting, but that much of level of coordination and communication is not able to get it out. So these are some of the challenges which I have find out during my interview, and I will work more on this paper, and work out on how more fruitful and more strategic research paper and develop during these days. So, ma'am, thank you very much for getting me. This is just a simple presentation which I have presented, because thank you.
Thank you, Mr. Dal Islam, for your presentation by giving us the information on the program activities and challenges faced by the youth volunteers as the frontline workers, and especially focusing on challenges faced by them during this pandemic situation. Thank you so much.
Thank you, ma'am. Thank you very much.
Answer sessions at the end. That will be done at the end. There may be one more paper, and after that, there will be question answer system.
जी ma'am. Thank you.
Next, I would like to call again Ms. Ijaza Sukli Sandi. If your problem is solved, can you give the presentation now?
Devika ma'am, I have just received the message from her that she is facing up with some electricity issue. So, Bijoy, what can be done? We will be announcing her name in a bit again. But there is a question, ma'am, for the last presentation that we got from Mr. Jainul Islam. There is a question by Eva Sara. Youth and unemployment, youth and drug addiction are these issues also faced by young people in Assam, especially during the pandemic?
Yes. Yeah, ma'am. Actually, during this pandemic, these are also one of the more challenges. And other, besides this, there are more other challenges like crime against women is also increasing. And this, during this pandemic, there's more number of addictions and alcoholism addictions are also coming up. This is also one of the major problem faced by the youths, especially. Youths are much frustrated, especially during this period, because what to do, what not to do, and what are the what kind of tools, what kind of facilities they are getting during this period, because they are just like idle men sitting, not doing anything. Simply, they're stuck in the home. So these are one of the big challenges. When I interaction during my TAP interview, I found that uh, especially alcoholism and crime against women has been increased more numbers during this lockdown period. And of course, drug addiction is also one of the major problem faced by the youth. And ma'am, actually, I have more focused on the especially youth challenges, and especially in Assam or in Tripura, situations are quite similar because more large number of alcoholism and drug addictions also coming up. Though they are facing also other challenges also maybe. I will stress on this paper more, and will find out the gist exact I need to work more, especially because to understand more in depth in this paper. Hello, ma'am. Yeah,
Thank you, sir. Thank you, sir, for your answer. So, is there any other questions? The questions can be dropped in the chat box. I think there are no other questions. Devika ma'am, you can proceed.
Okay, thank you, ma'am. Now the question sessions are over because there are no more questions. So we will be I will request our chairperson, Ma'am Lanu ma'am, to take over the session to give her key points on the presentations made by the various delegates. Ma'am, please.
Thank you, Devika. Thank you. The first paper, Rimika Jones and the Karnuki, isn't it? Village Council, Barbar Shillong, and Barbar Shang as frontline workers in combating COVID-19 pandemic, with special reference to Meghalaya. And I find that this paper is a very nice one, and they have made their study very nice by arranging focused group discussion even during pandemic and objectives and findings telling. I like the paper very much.
Thank you, ma'am.
Now, the other paper, The Gender Impact of COVID-19 on Mental Health by Dr. Asha Sharma and Dr. Vijay Das. Regarding this paper, I'll definitely say this paper contains a lot of information on gender impact of COVID-19 on mental health. And this has been discussed with particular reference to the mental health of the female gender. Anyway, but I feel the statements provided in the paper would have been substantiated with more primary and secondary data, it would have been more beautiful, actually. I understand it was not possible during the lockdown, and I understand the limitation, and I hope they will definitely give attention to these facts. Then Silpi Sikha's paper on the status of mental health during COVID-19. And she is good, but she could have made it an area-specific study. It would have been very good, actually. It contains lots of information on maternal health during COVID, but it is based primarily on secondary information. Regarding the other paper, the last one, youth volunteers as frontline workers, challenges encountered during COVID-19 pandemic by Ziaul Islam and Dr. Aditi Nath. Definitely, this paper was a good one. It is a good discussion on the frontline workers during COVID-19 pandemic. He has elaborated not only on the various aspects of the youth challenges faced by COVID youth volunteers. Again, I just want to add one point: if it can be done, if it was supported by some concrete cases available, it would have been more fruitful. Objective failure discussions are not very systematic. However, it is an interesting discussion, giving information on the youth volunteers during COVID. So thank you very much. I think we can end the session.
Thank you.
Thank you.
Thank you, Hanu ma'am, for all the reflection, and thank you, Devika ma'am, for moderating it. So we have come to the end of the first part of today's program. Now we will be resuming it shortly, and we will be resuming from 1:30 p.m. So this is a break that we can take, and we will be joining us again at 1:30 p.m. Thank you.